Hello, everyone, and welcome to Medical Terminology and Anatomy Review. The objective today is word elements, diagnostic and procedural terms, and anatomy. PRN, pro re nata, and when necessary. Now let's talk about word elements or root words. As you see here, there is a combination in reference to understanding what you're going to be looking for and understanding the terminology when you are reviewing code search in your ICD-10 and CPT books. So if you see here, for example, we see that we have dermo, which is a root word meaning skin, and then we have spleno, which means spleen. Combination or compound words you see here, we have cardiovascular. Cardio meaning heart, vascular meaning vessel. So we're talking about the vessels of the heart. Next, we have the neuro, which is kidney, and leth is callus or stone. So, with the combination of the word listed above, it's saying about the callus or the stones in the kidney. Prefixes and suffixes are also important. The combination of them both actually shows the full root word or meaning of a terminology and or procedure. As you see, the prefix we have the beginning of the word is tri, meaning three, and silent, meaning blue, with the suffix ectomy, meaning incision or surgical removal, and itis for inflammation. Anatomy is the actual structure of the body part and their relationship to each other. Physiology means the function of the body and how the body part works to carry out their life sustaining activities. Organ, multiple tissue type formed together to perform a specific function for the body. Organ system, a collection of body parts depending on one another to achieve a mature objective. Now, here are the different areas that you will be dealing with in your CPT book, which are all part of the anatomy. We have the integumentary system, musculoskeletal, cardiovascular, lymphatic, respiratory, digestive, urinary, reproductive, nervous, organ of the sense, which is eye and ear, endocrine, the hematologic, and the immune. Now, let's talk about anatomical positions. Now, when looking up different things in your CPT book, there are different positions that you need to understand that will be listed in maybe your descriptions of your documentation, or it could be also a part of the diagnosis. As you see here, we have the posterior and anterior, which is from left to right. And then we have also the lateral, superior and inferior, distal and lateral, the postal, and also medial and lateral, left and right, and we see up and down, and we also see left and right here. So, in the application of the documentation, it says that the tumor was photographed and then using a standard 24 French cutting loop, the tumor was resected. The solid portion was resected from the superior portion down to the inferior portion. So if you see here in the actual graph that we have here, superior is here, all the way inferior means up and down. Now, part of the integumentary system, we have skin, hair, nails, and in the CPT, it also includes breast in the integumentary system because it does have skin and glands in that particular area. Now, this is a breakdown of the different layers in the actual skin. We have here which is the epidermis, and then we have the capitula and the dermis. We have blood vessels, subcutaneous fat and muscles, sweat glands. We also have the collagen, superficial fistula, and also deep fistula. Means that it's the lower level of the actual skin. And we have it all broken down here. So keep this in mind when you are searching for your actual code listings and your actual terms. We're going to be looking sometimes in the epidermis area or the dermis area of subcutaneous tissue. So that will actually play a big factor in the search in your books, because if you understand what you're looking for, or the definition or the understanding of it, you will know how to look it up in your book. It won't always be the actual wording that's in the documentation. It could be the description or the actual anatomy or physiology medical term behind what you're looking for. So just keep in mind, you're not going to always look for those particular words. It could be another term that will be searched in reference to what you're needing to be looking for in your book. Let's look at example. 11042 is a debridement of the subcutaneous tissue. This includes the epidermis and the dermis if performed. And it states this description is for the first 20 square centimeters or less. For debridement of the skin, the dermis, the epidermis and the dermis, and it says only, it says C codes 97597 and 97598. Nail units. We have the root, we have the nail bed, the nail plate, and we have other areas of the actual nail bed that is actually broken down in layers. So keep in mind, as I said before, you might not be looking at the actual word that's in the description, but the medical term behind the word. Musculoskeletal systems, the systems of bones, muscle, joints, tendons, and ligaments that provides movement, strength, form, protection, and heat. Keep that in mind. We have bones. There are so many different bones in our bodies that we just don't know all what we have. But understanding your anatomy and physiology and the breakdown of those bones will give you a better understanding. Here's some example. Long bones are tubular. They are longer than they are wide. We have a short bones. Short bones are in our fingers, shaped like cubes. We have the sesamoid, which is shaped in a sesame seed. We have our flat bones, which is cross section is flat. And we have our irregular bones, bones that do not fit in the other categories. So just understand, look at those terms when it comes to the bones. Is it the tubular? Is it a sesamoid? Is it the short bones, flat bones? So just keep in mind of your actual graph that is actually in the front of your CPT book. And it shows you also the breakdown of possibly the nervous system, the skeletal system, and also those bones being broken down. Keep in mind, might not be the word, but the medical term word behind it. Now we have cartilage and joints. Cartilage description is flexible connective tissue, and it's a matrix made of the cartilage and the collagen and cells. The joints are provided connection between two or more parts of the skeleton. Human skeleton, we have the exoskeleton and we have the appendicular skeleton. Sorry if I mispronounced it. That's also another thing. In medical terms and in medical billing, there will be some difficult descriptions that you will not be able to pronounce. And excuse me if I don't pronounce them correctly. I know what they mean. It's just sometimes I get a little tongue tied. And in the doing of that, we also are going to see that some of these words are very difficult to pronounce. All right, so under the skeleton, we have the skull, the spine, ribs, the sternum, and the sacrum. And we have the shoulder, we have the pelvis, and other extremities. The functions of the muscles. We have the functions listed here, which is the contractures and the forms of the heat. And we have the skeletal, the cardiac, and smooth of the muscles. Cardiovascular system. We have under the heart, we have the different areas here. Under the blood vessels, we also have the arteries, the veins, and capillaries. The lymphatic system is the lymph vessels and nodes collect excessive fluid and returns it to the heart. The vessels ensure fluid travels in one direction. In the lymph node organs, we have the spleen, the thymus, tonsils, and the Peyer's patches. Now here's the respiratory and pulmonary system graph. Here we have breakdown of starting at the nasal cavities, the oral cavities, the tongue, the larynx. We have the fornix, the trach, right lung, left bronchus, right bronchus, the esophagus, and many other areas that are part of the respiratory system. So these particular terms are going to be some things that you're going to be looking for as the description in your ICD-10 or looking for an actual CPT code for any procedures that are related to the respiratory and pulmonary system. Please take a moment to look at those other areas. Pretty cool, huh? Let's move on. The digestive system. The digestive system is part of the gastrointestinal tract or the GI tract. Begins in the mouth and ends at the anus. It shows that it breaks down the food into the minuscule and the molecule size. The stomach. We have the opening of the stomach, the round upper portion of the stomach, the main portion of the stomach, which is the body, and then we have the lower portion. Okay, this is part of the stomach functions. Small intestines, large intestines, which includes the colon, the transverse, the descendant, the sigmoid, the rectum, and the anal cavity. So just to go back, you see the difference between small intestines. These terminologies are relating to the small intestines, and here's the large intestines. One thing that people don't understand is when they are coding for colon cancer. Keep in mind, colon cancer is in the large intestines. Just one thing, rule of thought. Large intestines, it has an endoscopy, and these different procedures show you the different areas of the intestines that are actually done. If we see the primary procedure, it shows that it's the rectum and the sigmoid colon. The second procedure is the rectum, sigmoid colon, a portion of the descendant colon, and a coloscope is the entire colon from the rectum to the cecum. The urinary system, urine production, and the structures, which starts the kidneys, the urethra, the urinary bladder, and the ureter. Reproductive system. Here's a breakdown of the females, which is external, which is the vulva. We have the clitoris. We have the opening of the urethra or urinary meatus. We have the internal, which is the vagina, the uterus, fallopian tubes, and the ovaries. We also have the male reproductive system area, external, which is the testes, the scrotum, and the penis. And the internal is prostate glands. We have the other glands and the ejacular ducts and urethra as well. The nervous system. We have two nervous systems. We have the central nervous system, which is the CNS, and we have the P and S nervous system, which is the peripheral nervous system. Part of the central nervous system is the brain and spinal cord, and the PNS is the cranial nerves and the spinal nerves. Functions as the central operation and central intelligence of the body, regulates the body function. It also provides for an internal method of communication. It regulates the subconscious body functions, the respiratory rate, body temperature, and of the intestines. It sends signals with hot and cold or sharp objects are encountered. Sorry about that. The sensor organs of the eyes, sense organs of sight. It has the layers, which is the retina, which is the nervous, the choroid, which is the vascular, and we have the fibrous. Two segments divided, which are the internal segments, and we have the posterior segments listed here. And these are senses of the organs of the eyes. Senses of the ears, the sense of hearing, and this is the different divisions of the ear, which is the outer ear, middle, and inner ear. We also have the otologic, which is the automedia services or surgical. These are all connected, each middle ear to the throat. The endocrine system is composed of the glands. Glands are a group of cells that secrete or excrete hormones, can be found in various of locations. Each gland and its associated hormone has a cause and effect that is unique. The hemic system, red cells, white cells, and platelets. These are the actual medical terms for those different things. So as I said before, when they talk about the red cells, we're going to look up the actual description, which will not say red cells. White cells is the leukocytes, and platelets, sites. The immune system is classified as a separate system from the hematologic system. Most immune cells have their origins in the hematologic system. Human immune system, body defense against evading microorganisms, harmful chemicals, and foreign body. There are two types of immune cells: the lympho cells, which is the B cells and T cells. The protection cells are listed there. Also in the immune system, we had the antigens, the elite of the immune response in the body, and the types of antigens that are in the immune system, and the antibodies in the immune system relates to proteins called immunoglobulins. Medical terminology and anatomy, word elements, the diagnostic and procedure terms, and anatomy. And this concludes our segment. Thank you.